A UK-based Nigerian health professional who moved to the United Kingdom on the 19th of February 2024 has had her visa is going to be revoked. She has been struck off the registry of the regulatory body of the professional she belongs to. Some people are claiming that this lady, she is an innocent, while some are saying that this lady should never have gotten the job in the first place because there are doubts about whether she actually went to study what she claims to have studied. Let me know if you have any sympathy for this lady. Some have said this lady's actions were premeditated. She could have endangered the lives of members of the public. Today, we are sharing the story of Ifeyinwa Chizubuke. She moved to the UK. Manchester NHS were looking for a health professional. They advertised the job and they received lots of applications, as you would imagine. One applicant's application caught their eyes and they decided at this time, Ifeyinwa was living in Nigeria. She applied for the job and they decided to go ahead and shortlist her for the interview. She went for the interview, which was done online, and they decided to give her the job. She came to the United Kingdom on the 19th of February 2024 and started the job on the 24th, 5 days later. When she began working the job, her supervisor, after 3 days, raised concern. The supervisor, in this case, Curtis Robert, met her on the 28th and found her description of her work in Nigeria inconsistent with what she wrote on the application. So that immediately raised alarm bell whether this lady, she is actually the person that wrote the application. There are lots of Nigerians and other foreigners who need opportunity like this to apply for a job from abroad and who are well qualified. People are saying that Ifeyinwa's action will make it harder and difficult for genuine people that have the skill to be able to get the job. When the supervisor met Ifeyinwa, the supervisor asked her basic question. She was unable to explain basic condition, including celiac disease, irritable bowel syndrome, and eating disorder. They were shocked that this is somebody that said she has a lot of experience in Nigeria. She wasn't able to tell the supervisor basic things, even cancer, IBS, she could not explain it. And that is when the supervisor and people started saying, oh, hang on a minute. Is this person, is she really qualified? Is this the person that applied for the job? She could not explain basic anatomy. They even asked her question like, where is the small intestine? She could not understand the difference between them. The West became suspicious that, look, it looks like this person, she is not the person that applied for the job or something has happened here. She further noted that she told her, she now said, oh, I have never worked in critical care and I've never had no experience in perinatal nutrition. The clinician was shocked and she couldn't believe it. They even took this woman to a place where somebody who's in hospital was being fed. They asked her, where is this? Describe what is happening here. She could not describe what was going on. That is when colleagues started saying, it looks like this person is not who she claims to be. She doesn't know what she is talking about. That was when she started telling them, oh, I haven't done this before. I haven't done this before. She could not even calculate BMI. She did not know what the sign or symptoms of dyspraxia were. She could not tell the risk of allowing somebody with dyspraxia to eat standard diet. She did not know how to dietically manage refeeding syndrome. She could not interpret biochemistry and could not interpret any symptom. That was when they were like, oh, in a separate incident, they took her to a hospital ward and asked her to identify a feeding tube visibly placed in the nose of a patient. She said, oh, it feels like they were breathing here. This is feeding tube. Even somebody who is not a medical practitioner knows the difference between feeding tube and something that they use to breathe. When somebody is unable to eat, they put feeding tube through their nose so that they can have some fluid going in. She could not differentiate this. And there are a lot of people who goes to hospital in Nigeria and other countries. You see people who do not have the qualification. You see people, there have been stories of somebody who was claiming to be a medical doctor and did not have the certificate. When they saw this red flag, they became suspicious that what is going on. They reported her because she was confused. She said, oh, I didn't use all this before. That was when they immediately alerted the authority and said, look, we have serious concern about this. The tribunal noted that even observe her, she was at work. They now noticed that she was Googling the questions they were asking her. They will ask her one question because she didn't know it. She quickly rushed and Googled. You applied for a band 6 job. A band 6 job is experienced healthcare practitioner, because when you finish university, you start from band 5. She applied for a band 6 job and they were seeing her rushing to Google basic question. That was when they said, look, before this lady come and kill innocent people in our ward, we need to report her straight away. Despite all the support that she was giving, they said she was unsure when she came after this. They didn't even ask her, say, look, so tell us, you were unsure what came after the stomach. With some prompting, she was able to say, oh, the intestine. When they asked her if it was the small or large intestine, she stated it was the large intestine. She said it was a large intestine. Referring to the statement, they said this is incorrect, which I found extremely concerning, as this is basic anatomy. Even somebody that did not even study up to university level know what comes after the intestine. Questions are now being raised. Who wrote the application for this lady? Did she actually have any qualification for this job, or did somebody apply for the job for her, coached her for the interview, and she got the job, and now she now realized that she doesn't have the experience? This has tarnished the reputation of Nigeria, because there are a lot of people from our community who need this job, who are qualified for this job. Because of things like this, when they see an applicant again from Nigeria, they believe that we all do the same thing because of the actions of people like this. The ruling says this is a premeditated plan, that she planned this thing and she was doing this thing simply, she deliberately, she knew what was doing. Another colleague who gave evidence said they had concerns about this lady. The hearing was told that she was unable to tell about celiac disease. Basic things she couldn't tell. Because of that, when the panel considered the claim, they said, look, you have engaged in serious dishonesty repeatedly over a long period of time with high risk of repetition, which could harm the public. Striking you off the register is the most appropriate outcome, and therefore she was struck off. Do you have any sympathy for Ifeyiwa? Knowing full well she could have harmed members of the public. Let me know what your views are. She was struck off. She came in February 2024, and part of the job, she may have to be deported if the job comes with visa. Let me know if you have any sympathy with her. Is it the work of the devil, or is she naive, thinking that she can get away with it? let me know. If you know anybody who know this lady, I would like to hear from you in the comment section whether you think that she actually have the qualification. Don't forget to like, share, and subscribe, and follow us on all our social media.